Welcome to the International Pro-Life Federation. My name is Ernestine Stanberry, aka Miss E. Everybody calls me Miss E. I'm director of the International Pro-Life Federation. Now today's show is a very interesting show, a very controversial topic. I have some very interesting guests here with me. Specifically, I have Betty. Betty, say your name.
Poisson.
Poisson. I like when she says that. Betty is a writer. She's an activist. And I have Mr. Jim Komanecki from RestoreAmericanLiberties.com. He's the director. And I have Mary Fitzgibbons. Mary is a pro-life activist, a researcher, paralegal, an ex-nurse. What else, Mary?
Current nurse, insurance person.
Insurance person. And before we get started, I want to read two poems by Betty. And she wrote these poems, you say, today or yesterday?
One I did a couple weeks ago, and this in here I did this morning.
This Voice of the Unborn.
That was 2 weeks ago, and the healthcare I did this morning.
Okay, the healthcare you did this morning.
I couldn't sleep, so I decided to write a poem.
Okay, I want to read this poem. It's called Voice of the Unborn, and she got the word abortion going down, and this is like an acronym for abortion. She starts out and she says, A, conception denied. B, before I had a chance to become me. O, only to be snatched out. R, robbed now as a bloody mass. T, torn from my mother's womb. I will never come into existence, never to become me. I will never crawl around. I will never say mama and daddy. Never run out with my book bag, and I'll never walk towards graduation. I'll never make a paycheck. I'll never have my own family or give you grandchildren. Never be help to you in your old age, and never to give you a final goodbye. Come to think of it, you never named me or said goodbye. By Betty. This was done in October. You said it was October this year.
Yeah.
And this one, this morning, yesterday you said?
This morning, around 3:30, I woke up, I couldn't sleep, so I decided to write a poem.
And this poem that she decided to write a poem about is about what we're going to talk about today. It's health care, and this is discussing the health care congressional bill. And we got health care. We're going to talk about health care starting with H, having good affordable health insurance. E, engaging with your own doctors in control of prescribed treatments. A, allowing all medical decisions to be made by the patient and doctors, not the bureaucrats. L, leaving final end-of-life decision with the patient and the personal doctor. T, the cost of drugs sold at less expensive markup prices. H, have your own positive outlook regarding your own self. C, caring for body with good eating habits and exercise. And R, relax mind and body with quiet moments. E, enjoy your living by thanking your God. And then she says, we are here live on CAN TV. Let it rip. I also want to show you some books here. And I was going through Thoughts, etc., by Betty. Very interesting book. Her thoughts on so many different topics. And another one is Life, Reflections, Dreams, and Memories by Betty. These books are some books that are really worth reading. And they're such inspirational books. This is a scrapbook of poetry and verse. This is by Betty. These are some wonderful books. This one is the one I have. I don't have a copy of this one. This must be one of your earlier ones. The one that's about the scrapbook.
Oh, that's the one that was on. That was the book that was online. It was a print on demand.
Really?
So that's the only way you can get the book. If you buy it, they'll print it.
Oh, okay.
Yes.
Wonderful. These are some wonderful books. And Betty, we all did a YouTube. Mary did a YouTube of all of us, and we gave our thoughts about health care. So Mary, why don't you kind of like go through the same thing that you did on the YouTube with Betty and Mr. Komanecki, and we just go from there, put in.
Well, Betty, whom I've known for a number of years, and she's inspired me. I won't say her age, but anybody who's with her knows that she's always thinking young. Her mind is always active. So in the late spring, in the summer, when I started hearing the legislation and tracking it because of my own background, I'm a caregiver for my 94-year-old father, my insurance background, being a nurse, I really felt strongly that seniors need a voice in this process, because I did not hear seniors speaking out. And I was not particularly pleased with what ARP was doing, because I didn't feel that ARP was speaking out in behalf of the seniors. So Betty and I spoke, and I started getting this passion to talk to different people, seniors, people that I knew who would feel free to have their voice go out on YouTube, because I figured there were other people out there whose voice gets heard around the world. And I thought, seniors, you know, let's get their voices out. So I spoke with Betty. I went over to her apartment, and Betty, you can pick up here as to, we first went into her office.
You came into my apartment, and I showed you around my apartment and what I do. I had this computer room. Because I'm legally blind, I have to have magnifying equipment. I have to have a computer that talks, so I have Zoom text which reads on my mail and applications, and this is how I do my work. I design greeting cards, and I write poetry, and I do different things with my computer. And so after you enjoyed me, and we both talked about this, we decided to put the camera in front of me, and you told me to tell you my feelings about this new Medicare plan.
Because I knew Betty has been following this very closely. Every day she watches what's going on in Congress, so continue.
Yes, I watch the live broadcasts on C-SPAN when they're in session. So I get it when they first start talking about it. Then when they finish, there are different things that they're talking about, and bills and things that they're passing and everything. Well, then I'll go on the internet, and then I get comments about what people are saying about them, so I can get some idea how the pros and cons.
Give us an example. Give us a scenario of the YouTube. You know, that is what got me. Your statements on YouTube.
Well, on YouTube, I was trying to tell her, she asked me how did I feel about the Medicare plan. I said, there's good and bad that I like about it. I said, but the things that I hate most of all, is what affects the seniors. And the fact that they're going to be cutting some of the benefits on Medicare so they can pay for the other end of the spectrum doesn't make sense to me. As seniors, we went out and supported everybody. We contributed and did everything, and now they're going to take part of the money to finance their new part that they want to fix, which is really an extension of Medicare. It's not reform at all, because Medicare has too many problems. Medicare is the elephant in the middle of the room that nobody's paying any attention to. There's doctors that are leaving their practice because they don't want to take the patients, because they don't get the money all they need for their own practice, because they're not being fully paid. And so that kind of stuff makes me angry.